Yes, so error test is the test, endometrial receptivity test. So this test is based on analyzing 238 genes, implantation genes. So each of these genes is responsible for production of very important substance, which is extremely needed for the embryo development in the uterus. This, when we know the level of activity of each of these genes, so we can to determine the window of implantation very precisely, and with less intercycle variability, like it was done with previous receptivity tests, which were based on histological examination, sonography, or so to perform the error test, we have to make the endometrial biopsy in the time of presumed implantation. Afterwards, we test this endometrium by means of NGS, next generation sequencing. So, and the conclusion of the test can be like that the window of implantation is displaced or is normal. In case when it is displaced, it can be either pre-receptive, so that would mean that we have to administer progesterone longer and later transfer the embryos as usual. In a post-receptive test, it will mean that we have to differentiate our embryos earlier and to transfer them earlier. So based on the error test, a new option in IVF appeared called personalized embryo transfer. So this option is based on freezing all embryos, and afterwards the window of implantation is detected, and we transfer these embryos according to the detection of window for implantation. So there's a very nice study published last year by Carlos Simon, one of the co-authors of the error test. So he showed in his 5-year multicentral randomized controlled trial that using personalized embryo transfer significantly improve the implantation rate, clinical pregnancy rate, live birth rate, using personalized embryo transfer than using just frozen embryo transfer, fresh embryo transfer. There is also very nice another Canadian study, which like 20% of patients who failed to achieve the embryo, who failed to achieve the pregnancy after one euploid embryo transfer. So they had displacement of window of implantation. That is why they recommend to use the personalized embryo transfer just after one failed IVF attempt with the transfer of euploid embryo. So in our practice, we use receptivity test too, but we use our local Ukrainian test, which is also based on the analysis of implantation genes. We have good results with it. It's cheaper than error test. So we also observe that there is some subgroups where we observe the displacement of window of implantation more often. There are the patients with genital malformation, like bicornuate uterus, state uterus. There can be some patients with endometriosis. So, but usually we perform the endometrial receptivity test after at least transfer of 2 euploid embryos or after conventional transfer of high quality blastocysts, 3 blastocysts in young age group, like up to 35 years old.